Hi, I'm Dr. Mickey Barber with Better Life Carolinas. I'm going to talk a little bit today about COVID-19 and coronavirus, and then I'm pretty much going to promise it's going to be the last time I talk about it because this month is June is Men's Health Awareness Month, so I have some other things I want to talk about, but today, just one last hurrah, particularly with all the protesting that's going on. If we don't see a big bump in this, in the number of corona cases, that will tell us a lot of information, so I guess we'll wait and see. I did want to encourage all of you with this new added stress of all this unrest that's going on. This is a time to really make sure that you're doing all the things that we've talked to you about. Getting plenty of rest, getting exercise, trying to decrease the stress that you can control around the house, which probably means turning off your phone and getting away from watching the news and staying away from social media. Taking the supplements that are important to support your immune system. Ashwagandha is one, all the B vitamins, vitamin D, vitamin C, some peptides that we recommend to support your adrenal gland, very important. Make sure that you're taking any medications that are prescribed for you, and of course your hormones if you're on them now. So seems like we were just coming down from the high stress level, and now we've got some new things to further cause us anxiety. So please take care of yourself during this time of need. I did want to read you a quote from the New England Journal of Medicine, an article that was published in April of 2020. It's up to you whether you wear a mask when you're outside or not, but I do want you to know kind of the facts. So they are quoted in this article as saying, and I'm going to read it for you, "We know that wearing a mask outside of healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet with a patient with symptomatic COVID-19. That is sustained for at least a few minutes. Some experts say more than 10 minutes or even 30 minutes. The chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic." We've looked at, with my colleagues, over 3,000 specimens. We have had only one positive COVID for the virus and only one positive antibody study. This is looking at patients from North Carolina, South Carolina, Pennsylvania, Texas, California, basically all over the country. So we know that it is a virus that exists, and we know that there have been people who have died from it and have gotten sick from it, not making less of that. But I want you to take your anxiety about the pandemic and dial it down a few notches. We're here to answer any of your questions at Better Life Carolinas. Please take care of yourself.